My name is Dr. Desmond Tutu. I'm one of the volunteer vets who carried out the program on Expert for Farmers. My experience is that this is a very good initiative, considering that currently government doesn't have extension service officers who go down to the farmer to give them the information that they need. Through these phone calls, we've managed to learn that farmers lack the basic information that they need to run their farms and also take care of their animals. This initiative, it was our first one, and we didn't know what we were going into, but it turned out to be very good, and farmers are very happy. On our side, on my side as a vet, I think I had the best chance to interact with mostly cow farmers who are worried about outbreaks and also zoonotic diseases that they hardly know about. In the process, I managed to explain to them how to handle an outbreak, how to inform the authorities about it, and how to go about handling antibiotics when a vet comes in. The withdrawal period must be observed, and also milking during that period is not encouraged. Most farmers didn't know about this because their cows were being treated, and at the same time they were consuming the milk. This is a big challenge to the whole world, the antimicrobial resistance that we are currently fighting with. Something else is that farmers don't know the difference between vaccination, treatment, and also deworming. So once they suspect something is wrong with their cows, they call a vet, probably and somebody who is not qualified, because there's a big gap between reaching the professional vets and the farmer. So they would call anyone in the village who practices veterinary medicine, come and inject something even the farmer is not aware about. So we've taught them to be asking about what the farmer is, what the vet is injecting, and why are they injecting, or what they are giving by mouth, and why are they giving it. So that if it is vaccination, it is clear to the farmer that their cows are being vaccinated against what disease, and after what period should they repeat it. If it is treatment, the vet must make diagnosis and also give treatment and describe the antibiotic that they are giving. If the farmer has a smartphone, they are able to take pictures of the animals and also the condition. If it's a wound that is not responding, if a vet comes and treat their cow, they ask the name of the drug. They can text or they can take a picture of the drug and share with us. Through this way, we were able to link up the farmer with professional vets, and we can pick from where the last vet left. If the vet injected oxytetracycline, we know and tell the incoming vet what had been done before. Through this COVID period, farmers were very distressed because markets were closed and transport was a challenge. Movement of people was also a challenge. So they were seeing cases where they have to discard or even consume more than they should because there's no market for their produce. Reaching out to the market to get input was also a problem. Another big challenge was that the children were home and the cost of living has really gone up because now they have to do 3 meals, which when children are usually in school, they really don't have to. This was a big challenge for them. Movement and curfew hours also limited their market. Given that people stay in the market up to late, when they are buying milk, they would sell milk up to 8 in the night. During the time when curfew was at 7 p.m., by 6:30 they have already left the market. And that is the usual time that they usually come into the market. So there was a big break in the market. They could not sell their produce and they really suffered a lot. The disease affecting human, most farmers in the villages are not experiencing the disease. So they think it is a disease for people in the city and also for the rich. So we managed to demystify that and also told them that this disease is there and is affecting everyone. Of all the farmers that I talked to, none of them had experienced COVID in their family and nobody had been in touch with someone who knows someone who had the COVID. So they were basically seeing it on TV and hearing it on the radio, but we managed to convince them that the disease is there and the measures that the government have put in place is to help them. Thank you.